Just as way of background, I'm born and bred in Manchester, went to university in Salford. And my role is, I've got two roles. I'm head of digital for Health Innovation Manchester, and I'll tell you what Health Innovation Manchester is. I'm also head of digital for the Integrated Care Organisation across Manchester. So my job is to make all this stuff work from a digital perspective. In terms of Health Innovation Manchester was born really as a recognition of devolution. So just suppose stepping back in terms of why devolution happened, what devolution is basically the health and social care budget being devolved to Greater Manchester. So about £7 billion being given to Manchester to have its own direct control about how that money is spent. And when you look at the reasons why that's the case, fundamentally it's because of the challenge, the direct relationship between poor health and economic growth. So net, basically, Greater Manchester was operating below its economic potential because people were sick and ill. So there's a direct relationship between growth and health, and that's why health is so central to Greater Manchester, and that's why Greater Manchester was the first reason for devolution. When you think about Manchester, Greater Manchester, and you think about the rest of the UK and the rest of the world, the health challenges are pretty similar. We've got an increasing burden of health due to lifestyle issues, and your health outcomes, most of your health outcomes are directly related to your lifestyle choices, not about where you're seen or your genetics. So there's a huge implication in terms of how we build society around the person. So when we talk about the health and care bill, it needs to be viewed in a much broader context of all the other things that need to be done. From a Greater Manchester perspective, we've got below life expectancy for both men and women, and we've got a third of children that are disadvantaged from birth. So we've got a huge sort of challenge. And we've also got an ageing population, and we've got an overstretched workforce. So what that basically tells us, we need to do things differently. And the reason why integrated care is so important is, transforming and making an individual hospital more efficient is not going to deliver the level of change that we need to do. And just to give you some rough facts, so 10% of the NHS budget is based on diabetes. 1 in 32 people has diabetes, and 1 in 3 people is on the precipice of having diabetes. So you can see from an economic perspective, if that tips over, then the health service becomes unviable. So when you look at the integrated care build, you need to look at it in the wider context of what is happening around the local industrial strategy, which is how we're going to generate growth across the economy. There's a big push around technology and artificial intelligence, especially in Greater Manchester. We've got 10,000 open vacancies for tech-enabled jobs within Greater Manchester. There's a huge focus on the life science and drug industry. So if you've ever read the Life Sciences Vision, that's around the UK being leading in drug development and delivering novel therapies to people. There's a big focus on making research much more tailored to individual population needs, which have a much broader span in terms of their target around the individual needs of a particular patient. So all those things need to be taken in context, and net, if you look at the Marmot review that's just been published, you're 2.3 times more likely to have poor outcome from COVID in Greater Manchester if you come from a poorer background than from a wealthy background. So effectively, your health is directly related to wealth. So one of the key things is this needs to be seen in the context of how you grow the economy in Greater Manchester, because better jobs, better housing, better transport, and better education are fundamentally the key things that we need to shift the dial on. So with that sort of context, I'm going to go through a set of slides in terms of some of the technology strategy that we're adopting. Just a bit of background about myself. So I spent 25 years of my life in industry, leading some of the largest scale transformation in healthcare, and I sort of smile because I've seen digital done well. I've also seen it done really poorly as well. And I've learned some important lessons through my life. Is you focus on the problem, not the technology, and that the solution to that problem involves people, process, and cultural change. So if you spend £1 on the technology, we should be spending £3 on this service transformation, the people and cultural change. So technology for technology's sake will not shift the dial. So I'll just go through a high-level view of what Greater Manchester's view around the health and care strategy because it's directly related. I think we're quite advanced in terms of the ICS understanding because, from a 2016 we were devolved, so we've essentially been operating as an integrated care organisation. So over the last 2 years, we've completely reset our strategy. So to make sure the digital strategy is absolutely subservient to the GM response to what was then the taking charge strategy and now the ICS strategy in terms of integrated service delivery. We've done a lot over COVID. These are some of the things that we've done over COVID over the last 18 months. I'll just focus on a few of them. The GM care record, you may be aware that we've got a single record now with 99.9% of all the patient records from the whole of Greater Manchester on a single platform. So whichever care setting you go into, the GP, the emergency department, the social care should have access to your integrated care record. So we've really accelerated that across COVID. We've also removed all the walls and data. So previously what happened is if you were a Manchester resident and you went into Salford, the Salford clinician couldn't actually see your record. So we've removed all those walls. So that's been a real transformational asset that's driven real change. We've increased clinical usage by 3 times, which has been a massive advocate to the availability of the data to improve direct care. So what does it mean? What that means is the patient tells their story once and the clinician can make more informed decisions at the point of care. The other key thing it's done is it's enabled us to have a rich set of data and information. We've now got 25 research studies operating on that platform. The first one was published a few weeks ago, showed some startling insight in terms of domestic abuse during the COVID period. So huge sort of capability. We've done a lot around stop smoking. So you may be aware that smoking in pregnancy is one of the biggest issues within Greater Manchester. We were sort of bottom of the charts a few years ago. We're now towards the top in terms of helping pregnant ladies stop smoking. We put a digital platform to really encourage that process. And basically what happens is when you're pregnant, you have a CO2 test. If you're found to be smoking, get referred to a stop smoking service, and the midwife sees you every week and provides encouragement. Through that process, we do encouragement through digital channels like SMS, text messaging, say, it's Friday night, don't go for a cigarette today. So it's been real sort of powerful sort of delivery. Just picking on some of the other key elements, care homes have obviously been devastated through COVID. So we put a digital solution in. I think we've got it in probably about 350 of our 500 care homes across Greater Manchester to enable us to track deterioration. So what this means is the care home staff on a daily basis look at every patient. They do a very simple 6-point check that then goes to a clinical hub. The clinical hub then directly reach out to the care home to see if there's anybody deteriorating. The final one to mention really is Smart Heart. So this is an incredibly sort of innovative piece of work that we've done. So there's around about 28,000 people in Greater Manchester with heart failure. Economic cost is about £800 million. Heart failure is a deteriorating disease, so it gets worse over time. The typical progression of the disease is you go through exacerbations, and the typical pathway for an exacerbation is you start to feel unwell. And most of these people got some sort of device that is like a pacemaker, if you will. So the typical pathway is you start to, the device notices some deterioration, but you feel fine in week 1. Week 2, you're feeling slightly unwell. So you take paracetamol. By week 3, you're immobilised, and by week 4, you're in A&E. And typical length of stay is probably about 2 weeks. So we've completely sort of reimagined that journey by saying, how can we use digital to actually transform about how we deliver care? So we've been working with a device manufacturer to be able to detect the signal straight from the device over the internet. And then we put a clinical service around that. So now the alerts are automatically fed into a clinical call centre. And before the patient knows that they've got an issue, the clinical staff proactively reach out. And the research, which is about to be published, suggests that most of the interventions are medication changes. So what that means is that in that 4-week deterioration, we're able to detect deterioration in the first couple of days and then set them back to day 0. So huge sort of opportunity for transformation. In terms of what the ICS white paper says from a digital perspective, this is called out on the chart on the right here. So Key things to bring out, you need a 3-year digital transformation plan. So what that means is, what are you actually going to do and execute? You need to develop a shared care record. We're probably one of the most advanced in the country in terms of our shared care record infrastructure. You need to reimagine care pathways. So a good example is the Smart Hearts one. So how do you actually reimagine the way you deliver care? And the final one is you wrap all that around the citizen. So how we design services that are not service driven, but are people driven. And that's a real key challenge. However, digital's got the real power to actually personalise services to individuals. So in terms of the left side of this chart, this is some of the challenges when I came into post about 2 years ago that I was sort of experiencing, which is, we spend a lot of money on digital and investment. When you look at some of that, you go, how is it actually changing clinical outcome? So providing real connectivity, if you're going to spend X around digital, how is that actually going to affect true outcomes? So we've built a methodology that enables us to go from health outcome now to digital investment, which I'll briefly go through. I think the other key challenges are, and this is what we're still working through with the national team, a lot of the funding is very fragmented. So when it gets delivered to us, it's very short term, it's very in year, doesn't often seem joined up from the centre. So, we recognise some of those challenges, and, those are sort of deep rooted challenges about how capital money and revenue money flows into the NHS. But one of the key things that we wanted to do was sort of get on top of that and say, okay, based on all that, how do we get a real good view of our priorities for the next 3 years? So we've done some real deep engagement over the last 9 months, and we focused this engagement on going through specific citizen cohorts, so understanding people deeply, from that understanding what digital capabilities are required to support those. We've also been through our service transformation areas, so we've got 7 major themes of transformation in Greater Manchester: emergency care reform, elective reform, dealing with the elective backlog, cancer, mental health, women and children, maternity. And we've also looked at it from a care setting perspective, so from primary care and secondary care, and we're just going to do a deep dive in social care in the new year. So what we've basically done is we've taken a very much sort of persona-based view, a patient and people-based view of the typical sort of residents within Greater Manchester. Now, these aren't intended to be very specific, but they're supposed to give a broad brush view of the type of characteristics of the typical population we have in Greater Manchester. And then from each of these, we've done some deep patient and public engagement with clinicians and operational teams to truly understand their operational needs and the clinical needs. So for each of these, bit of an eye chart, but what we've done is we've truly understood the type of challenges those individuals have with those characteristics. From that, we've done their existing pathway through the health and social care system. From that's enabled us to identify real pain points and opportunities for improvement. We've then looked at those opportunities for improvement and said, okay, how do we map those to the health outcomes we're trying to achieve? And from that, how do we reimagine the patient journey using a set of digital capabilities? And what this has enabled us to do is create a wiring diagram, bit of an eye chart here, that takes us from health outcome that we're trying to shift, the intervention that we're trying to drive clinically to shift that health outcome, the pain point we're trying to overcome that is a challenge for patients and people to engage, and then what is the digital capability that's required to drive that transformation. So what all that has led us to then is an overall framework that represents 47 digital capabilities that we're going to focus on from a Greater Manchester perspective. Each of these capabilities, we've got a level of maturity 1 through to 5 of, 1 being the least mature, 5 being the most mature, and we've set a guardrail. Where do we want to get as a minimum in each of these, and where do we want to get as an aspiration? And we've also done an analysis about where we are. So what that's enabling us to do then is target our investment in terms of the toppest priorities that we want to focus on. Now, this has been quite a transformational piece of work, because now we've got a common language across all care settings: primary care, secondary care, just about to do it in social care. So when we go into a meeting, we talk around integrated shared care records, or we talk about understand and predict population health need. And because the way that we've done this is been very clinically and operationally led, so this is not techie language that we're using. So under each of these, the definition of maturity is based on achieving an outcome, as opposed to do you have a thing. So for the first time, I think what this process has enabled us to do is really sort of take a deep, thoughtful insight in terms of the needs of the population, a deep, thoughtful insight in terms of the needs of the service transformation areas that are driving Greater Manchester, and a deep insight in terms of the modes of care, primary care, secondary care, and social care. And from that has enabled us to come up with a set of requirements in terms of our digital priorities for the next 3 years, which will form the basis of our 3-year digital transformation plan. That enables us to identify the quantum of the investment that we need, which is circa £330 million, so it's a huge amount. And then what we're doing is mapping it to what funding do we actually have, and how does that flow in from an ICS perspective in terms of digital funding. You'll be shocked to hear that we need more money than we're actually seeing that we're able to get. So what this has enabled us to do is have a conversation like never before between clinical, finance and digital teams to be able to determine what decisions that we need to make to square that very difficult circle. So I think from an ICS perspective, this method we're working with NHSX, if anybody's familiar with NHSX, around how they encode that into the what good looks like framework, because I think we've got a level of detail that is probably missing from what good looks like. So hopefully you'll see more of this being rolled out potentially nationally as well. So hopefully that gives you a whistle-stop tour of some of the things that we're doing in Greater Manchester. And it's, as I say, it's a real privilege to be here, especially because I'm born and bred from Greater Manchester. Thank you.